This video demonstrates how to support patient participation and submit clinical forms and reports for the National Lung Cancer Screening Program. Submitting accurate and timely clinical information is crucial. It helps ensure your patients are placed on the correct screening pathway, receive appropriate reminders, and timely follow-up. Without this, delays in care may occur. In some cases, the NCSR's follow-up team may contact you if a patient has a high-risk result but no clinical action has been recorded. The eligibility and enrolment form can be accessed when you search for a patient who is aged between 50 and 70. If the patient is not already enrolled in the program, you'll see a prompt to enroll in lung cancer screening. This form is used to assess your patient's eligibility for lung cancer screening and to formally enroll them in the program. Once enrolled, and if suitable for low-dose CT, patients can be referred for a scan. Results, excluding scan images, are recorded in the NCSR and shared with the referring provider. The patient will not be able to see the results. This form can also be used to note if a patient is eligible but declines to participate or have their results recorded in the NCSR. Note if a patient agrees to have their information recorded but does not want to receive invitations and reminders to screen. Or record when a patient does not meet the eligibility criteria but may in the future. Once submitted, the patient's record is updated to confirm their eligibility, activating the NCSR safety net, provided they have not been marked as unsuitable for low-dose CT or opted out. They'll now receive invitations, reminders, and follow-up as needed until they are no longer age eligible, are opted out, or marked as unsuitable for low-dose CT. This form will only need to be submitted once to enrol a patient in the NCSR. Patient NCSR history displays cervical and lung screening histories and previously reported clinical information, including outcomes and program-related correspondence sent to you and your patient. You can filter by program if your patient participates in more than one. Otherwise, only the relevant program will display. To view past radiology results, excluding CT images, click Lung Screening History to generate a downloadable summary PDF. Click Choose a Form to submit clinical forms and reports and manage participation in the program. The list below displays all available forms for the lung cancer screening program. The list will vary depending on where your patient is on the screening pathway. Participation Management Form. The purpose of this form is to update the NCSR with the details of a participant's follow-up visit after receiving their low-dose CT results. This ensures appropriate management of the participant within the NCSR. No action is required if your patient did not have any findings. The NCSR will note their next scan is in 2 years and will remind them ahead of time. You can update your patient's status, such as confirming if they should exit the program if they opt out or become ineligible, or recording a clinical reason to stop screening, such as cancer diagnosis. If there are any changes to their suitability to low-dose CT, this can also be updated through this form. Keeping this information accurate helps ensure patients receive only relevant invitations and reminders and avoids unnecessary follow-ups. You are able to use this form several times if needed. In most cases, this form is used to exit someone from the program. When your patient turns 70, they will automatically exit the program, and you will not need to complete the participant management form. Biopsy Adverse Events Form. If needed, report any adverse events following a biopsy. This supports patient safety and informs clinical decision-making and contributes to quality and monitoring of the program. Specialist Referral Form. Notifies the NCSR of referral of patients with a Category 5 or 6, high to very high risk, low-dose CT result to a respiratory physician or other specialist. Prompt notification will avoid the NCSR follow-up team contacting you to seek information to ensure your patient is getting timely investigation of results and potential diagnosis. Diagnosis Form. Record confirmed diagnostic findings after low-dose CT scan to report whether lung cancer is present or absent following further investigation of a Category 5 or 6 result, indicating high or very high risk. Accurate reporting helps guide future screening decisions, such as whether the patient should continue or exit the program, and supports timely clinical care, national reporting, and quality improvement. This form can be updated as more information becomes available, as the full staging detail, for example, may not be known at the time of appointment. The following forms are available to manage your patient's participation in the lung program. Defer lung program, to change your patient's next screening date, for example, due to travel. Opt-out lung program, will end your patient's participation in the program. No reminders will be sent and results won't be recorded. Patients can resume participation through the participant portal, calling the NCSR, or at the request of their healthcare provider. For more information about the National Lung Cancer Screening Program, visit health.gov.au/NLCSP.